There we go. Perfect. Now I see it in full screen. Thank you so much, Shelley. So I'm going to go ahead and jump into things so that we can make sure we cover all of the materials today. Just a heads up that this meeting will be recorded for the purpose of record keeping, being that this is public record. So does someone need to start recording?
Already did.
Perfect. Thanks so much, Claire. I appreciate it. I just didn't see that on my screen. So first and foremost, on behalf of the Oregon Health Authority and the Temporary Healthcare Staff Rate Setting Program, just want to thank you all for taking the time out of your day to provide us insight on the continued development of the rate setting program outlined in House Bill 2665 and passed in the 2023 legislative session. My name is Joe Sullivan. I'm the manager of the Temporary Healthcare Staff Rate Setting Team. I'll be co-facilitating this session with my colleagues, Rodney Manelis, the policy lead, Shelley Huber, implementation lead. Additionally, our project manager, Claire Schultz, and our research analyst, Brian Lothrop, are here. We appreciate you taking time out of your busy schedules to discuss the rules we continue to refine as we strive to establish rules that uphold the intent of the legislation and also creates a program that effectively serves those adhering to the requirements of the bill. The reason we hold these racks is to hear from folks who are going to be impacted by the legislation and rule set. But before we dive in, there's a few things we'd like to cover. So we'd like to uplift the following participation guidelines and ensure we have shared understanding regarding how this meeting should function. We'll be asking folks to raise their virtual hands when they speak. The raise hand function is available in the toolbar just below in the Zoom screen. I apologize. Staff will keep you muted until you're called on by one of the facilitators. We'll also ask folks to be respectful of the time we have allocated for each agenda block, which program staff will ensure we adhere to. Additionally, you'll be provided a smart sheet form that will allow you to submit any feedback you are unable to share during this live meeting. We'll deliver the link at the conclusion of the meeting, and it will be disabled 24 hours after the meeting end time, which is 10 o'clock tomorrow, 8/21. It's important feedback is received before then to be considered part of this engagement process. We hope this will allow for a smooth conversation and for all input to be received and considered. There's also a public comment period and a public hearing beginning in October. Please remember that all opinions are valid. While we may not align on all things, it's important we avoid argument or commenting on the validity of other statements. And in the cases of opposition, please express that in a respectful manner. Lastly, we ask that you acknowledge and respect power differences. We don't all hold the same level of influence or power in this space, so want to be cognizant of that. So what is a rule advisory committee? So as part of the rulemaking process, OHA can appoint an advisory committee to support updating proposed rules. The advisory committee would include persons likely to be affected by the rules and would meet with the division to discuss and give feedback on the proposed rules. The RAC includes an overview review of the draft language proposed by OHA and an opportunity for impacted parties to provide feedback, and does not include a discussion of the validity or efficacy of the legislation or an opportunity to change the House bill. As part of your role as RAC members, we expect folks to have an opportunity to provide feedback on the draft text rules and offer suggestions to improve the implementation of the program. We also ask that folks pay special attention to timelines and industry jargon. Therefore, our goals for today are to review the draft rule text, identify changes in wording to ensure shared understanding of project expectations, and identify any potential challenges for your industry related to the planned program implementation. So again, a reminder to provide any comments not shared in session within 24 hours from the end of this meeting via feedback web form that will be provided via email in the Zoom chat. We are aware that some of you have also been asking questions via email, and more will likely arise during this process. In order to provide clarifications on the most commonly asked questions, we will update the FAQ on our program website. I say all of this to make sure the folks know that this hasn't been and will not be the last opportunity for you to share thoughts on the development and implementation of House Bill 2665. Before I hand things off to Rodney, I want to thank you again for your continued commitment to helping us implement a program that meets the needs of those most impacted. If you have any questions or concerns, my email and the program email is available on the screen as well as our website. So I'll go ahead and hand things off to you, Rodney, to walk through the proposed rule changes.
Thank you, Joe. Good morning, everyone. My name is Rodney Manolis, and I serve as the policy lead for HB 2665, temporary healthcare staff rate setting program. For my portion, I'll be walking us through the draft rule edits section by section. Here's how it will be done. Here's how we'll do it. We're focusing only on the tracked edits you see on screen. When there's a new language inserted, I'll read the full insertion. When there are smaller changes like correcting an ORS citation, capitalization, I'll just call those out. After each change, I'll pause briefly so you can share feedback. Please reference your comments using the OAR number and subsection. Just a reminder, today's scope is the rule language on the screen. If you have broader program or operational questions, please submit those through the feedback form that will be made available after the meeting so we can keep this session focused on the rules. With that, let's begin with section 409, 039, 0010 definitions. The following is an addition. Subsection 4 bill rate means the hourly wage rate plus fees and agency margin charged to the client exclusive of per diem stipends. I'm going to call out all numbers following the addition of subsection 4 updated to maintain numerical order. In subsection 6, certified nursing assistant, CNA, ORS range corrects the reference to ORS 678 44 from 2 to 0, 678 448. Subsection 16, Indian healthcare provider, IHCP capitalization, clarifies the capitalization of urban and organization. Subsection 21, the following is an addition. Per diem stipend refers to an allowance paid to personnel for lodging, meals, and incidental expenses while on assignment that is based on the rates published by the U.S. General Services Administration, GSA.
Rodney, let's pause maybe like a little extra second here to see if anybody has any feedback so far. I don't think we've seen any hands, but just in case.
Got it. Thank you.
But I don't see anything. I think you're good to keep going. Sorry about the interruption.
No, perfectly fine. So here's a call out. The old rate definition has been deleted to avoid conflict with new bill rate, wage rate definition. Subsection 28, the following is an addition. The wage rate means the hourly pay rate received by the personnel exclusive of agency margin, per diem stipend, and other supplemental pay. We'll move on to 409, 039, 0020, scope and applicability exceptions. The call out here is the terminology alignment only. Bill rate replaces rate here, so no other changes. So there are no other changes. 409, 039, 0030, health professions, personnel covered. Terminology alignment only for subsections 1 and 2. Maximum bill rate replaces rate here. No other changes to the personnel categories. And I'll pause right here briefly. All right, continuing on to 409, 039, 0040. Excuse me. Sorry, onset of a cold. 409, 039, 0040, maximum rates for a hospital or facility. Some housekeeping. Subsections 1, 2, 3, the terminology updated to bill rates. Also deletes the phrase and will be published on the program website from the subsection 3. Moving on, the following are in addition introducing the multi-year effective date framework. For calendar year 2025, maximum rates are effective starting January 1st, 2025, and apply to rates negotiated on or after January 1st, 2025. For calendar year 2026, maximum rates are effective starting January 2026, January 1st, 2026, and apply to rates negotiated on or after January 1st, 2026. Subsection C, for calendar year 2027 and later, maximum rates will be published in the fourth quarter of the prior year and are effective January 1st of each year for service dates on or after January 1st. I will pause here briefly. And on the screen, you will see for calendar year 2026, maximum rates are listed in 0040 table. Okay, Shelly or Claire, are there any hands before we move on? Are there anything in the chat?
We have one hand. We have Jeff. I think I just clicked unmute. You're welcome to unmute, Jeff.
Yes, good morning. Curiosity around the rates in table 1. Can you share with me what was the methodology behind these adjustments?
Rodney, I can go ahead and jump in here and explain. Thanks for that question, Jeff. So we used the same methodology that was posted on the website last year. So the legislation requires us to start with BLS OED data to begin the rate build. So we start from that and then build in some different components and add the margin at the end to result in the rates. What we've seen as we've gotten further away from COVID, as the reports come in, those wage rates are decreasing for folks in these positions per the BLS and OED data. So we'll continue to follow that data. And as we see fluctuations, rather up or down in that data, there will likely be some influence on the rates moving up or down in those positions based on the BLS and OED data, barring a change on the margin. And because the margin is maintained at the same level for this year, those wage rates wound up decreasing the rates in a few different areas.
What about the decreases?
Yeah, the BLS and OED data show the decrease in the wage rates, which is what results in the decrease in the maximum bill rates.
Okay, so you're going back, you said further away from COVID. COVID was 3 years ago, 4 years ago. And what was the consideration for inflationary pressures that we've seen over this last year? And then these rates are forecasted for, we're developing, formulating rates for 26, which is another year and a half out. So are you telling me that inflation hasn't increased over the last year and is not going to increase in the next year and a half?
I'm certainly not making any statements about inflation or what has happened with the economic reality. What I'm stating is that the legislation requires us to use BLS and OED data that includes a trend forward to 2026 that it accounts for inflation. So those things were actually included when we pulled this data from BLS and OED.
So OED rates are CNAs, let's call it the 90th percentile, which temporary staffing agencies should be in the 90th percentile. We're trying to persuade these employees to get off the couch and come to work. They should be earning a higher wage. And for CNAs, for example, their OED is 31 for 25. I would expect there's going to be some. I mean, we're behind that on just the 42.23 rate for CNAs when you built in taking into consideration the margin. we're behind for 25 already, and we're in August of 25. So those rates for OED, if you're citing those, we're below those rates currently. So we're not keeping in line with what the inflationary pressures are and OED rates that you're alluding to.
I appreciate the feedback, Jeff, but we utilize the technical advisory group built of economists, actuaries, and other folks who lead and work in those positions for state agencies, and convened a group that helped us track that OED and BLS data in the implementation of building these rates. And I'm sorry to disagree with you in this public forum, but I stand firmly on the calculations that we've done and how we followed the data required of us per the legislation. If you have any additional feedback or comments about that, you're welcome to share those via email or via the comment form that is available at the end of this committee meeting.
Yeah, I'm not arguing with your OED rates. I'm not arguing with you regarding that. I'm just saying the rates, I agree with the OED rates. The problem is these bill rates shouldn't be, they should be increasing based on OED rates and inflation. And that's not what I'm seeing. That's not what we're seeing here. You're adjusting down, whereas have you gone to go? You're telling me that when we go to the grocery store, that the cost of goods is gone down rather than up? Is that what you're telling me?
Sir, I'm going to respectfully ask staff to just go ahead and mute you if you don't have any other comments that are in relation to the comments or the actual rates or the language that we're using here, so we can continue this conversation. Okay. I think all of us recognize to go
on the record, the CNA rates, marketplace rates, so we can offer our CNAs a fair livable wage should be in the $45 to $46 range. The CMA should be in the $50 range. And the rates for RNs and for hospitals and for other facilities should be commensurate to what we was for 25 and what we would expect to see in 26.
Okay. I appreciate that, Jeff. We'll definitely record that feedback. And if you have any additional comments, you have our email as well as the form that will be available at the end of the meeting.
Before we go to Julie Tate, again, just want to remind everyone that there will be opportunities, like Joe just said, outside the session to provide input on the rate levels. And for now, let's just capture your concerns and through the feedback form so we can be tracked, and then we can keep our discussion centered on the wording and of the rules. So I see Julie Tate.
Hi there. Thank you so much. I appreciate it. I definitely concur with Jeff's concerns specifically around the CNA rate, especially as we're seeing thousands of open orders each week still unable to be filled. However, my bigger concern, that is a huge concern. However, my bigger concern on this is the CMA is actually a higher level certification than a CNA, and the rate is lower. And so you're asking a higher level certified individual that has additional education requirements, additional licensing requirements, additional credentialing requirements for us to actually be paid at a lower rate. And that logistically makes zero sense. And as Jeff mentioned, that should be in the $50 range. This will eliminate any ability for someone to fill a CMA at this rate. This is extremely, extremely low. And I don't know where that data came from that produced that rate, but that I can't even imagine this. So I also like to go on the record to state that, we need to be looking at other factors that include the amount of unfilled orders, the inability for facilities to take discharges from hospitals because they don't have enough staff because these rates are so low, and then the inability for us to recruit individuals because you're offering a rate that is below a peer they'll be working with that has lower experience and education and certifications than themselves. So thank you.
Thank you for the feedback, Julie.
Thank you. Julie and Jeff, and we're going to continue with 409 0390050 waivers to charge more than the maximum rates. Here in subsection 1 and 2, terminology updated to bill rates. And here, subsection 3, the following is an addition. Waivers approved by the authority permit a temporary staffing agency, TSA, to exceed the maximum bill rate from a certain period of time. Maximum agency margin must remain at the percentage specified in OAR 409-039-0040 subsection 3. I will pause right there. Moving on to 409-039-0060, application process and review of emergency waivers. In subsection 1, 4, and 5, terminology has been updated to bill rates. I will pause there before we move on. Similarly, in 0070, application process and review of non-emergency waivers, terminology updated to reflect bill rates. Four zero 409-039-0090 annual evaluation of maximum rates. Subsection 3, the following is an addition. The authority will refer violations of the maximum bill rates, maximum agency margin, and/or waivers to the authority's health licensing office for investigation and disciplinary action. In 01,
Rodney, we
yes.
have a question from Cicely,
Yes.
or a hand
Cicely.
raised.
Yes, on the annual evaluation of maximum rates, the language surrounding disciplinary action, is there a way that we could add the types of disciplinary action we could see, if they would be monetary, if they would impact the other side of the legislation, and there could be loss of license as a staffing agency in the state, if we could just have that? And secondarily, will violations or investigations that end in disciplinary action, will those be public knowledge?
That's great feedback, Cicely. Can we make sure that we're capturing that in the comment, Shelley? We can definitely provide those clarifications.
Thank you.
Thank you, Cicely. So moving on to 409-039-0100 data requests. Again, in subsection 1, the terminology updated to bill rates. And in 409-039-0120, information sharing and use of data. Here we have a terminology alignment and clarification replaces OHAs with the authority's health licensing office. I will pause right there for any thoughts, concerns, or feedback. Okay. I will pass it along.
Yeah, thanks so much, Rodney. One thing that I do want to state before we go ahead and wrap things up, and I'll give a second for folks to raise hand if they have any additional questions. We can go back up to any section you'd like, is we can make a commitment to, we'll go ahead and review the BLS and OED data and make sure that we started from the accurate place. I'm confident that we did, but we'll make sure that we go back and verify that we're following the methodology and starting from the point that the legislation requires of us. If folks have other questions about how the rate methodology functions, the instructions and background details are available on our program website that show the different factors and components we add on after we start with that BLS and OED data to wind up with these temporary staffing maximum bill rates. And the last thing that I'll leave you all with is that regardless of where these rates set, we do expect that there is some option and opportunity for negotiations between the three parties participating in these agreements. And we want to make sure we continue to give space for that to happen. So we hope that we've been responsive to the concerns that you have. We will make a commitment to continuing to work through this iterative process and strive to make a program that supports the legislative requirements as well as all of you as impacted parties. I see Julie's hand is raised.
Yep.
Would there be any discussion around the required annual reporting that we went through the first round of this year, or is that a separate call?
Not in rule, Julie, but if you would like to give us feedback on that annual reporting, if you could send it to us via email, that'd be really helpful. We recognize that was probably likely there will be some changes that we're making ahead of next year. So now is the perfect time for us to get that feedback. It's just not a mechanism of the rule, so we weren't talking about it today.
Got it. I'll do that. Thank you.
Maybe give one more minute for hands to come up just in case folks have questions that come to them last minute.
Looks like we have another hand.
Hey there. Thank you all for your time today. I know that this session was more focused around the actual linguistic and the language in the bill. You've also alluded to the fact that maybe we can email you all with kind of greater concerns. I guess for a quick backstory, I've been in the industry only for a year, so I was new to this and came into this before I was able to kind of speak my concerns. Is there a forum for us to speak to you all directly like this? I know that hopefully it wouldn't get out of hand, but just to really address the concerns that we have for our own employees and in the business or the well-being of our businesses. Again, I get that these are very pointed discussions around language in the bill, but I do feel like me and probably some of my colleagues here feel like the feedback that we're giving is just kind of getting put into a blank wall or an email auto reply that says, hey, this is what it is. And the fact of the matter is, I think in general, what is this trying to do? Are we trying to help for better care for the individuals in these facilities? And I think the effect that we're seeing right now is the exact opposite. And Jeff alluded to for our employees too. They're doing extremely, extremely hard work and they could probably get paid more to go, serve tables somewhere else. And that's affecting the people that need the care. So the long story short, is there another forum when we can have hopefully a true discussion around what's happening?
Yeah, so I think starting out would be to reach out to us via email to give us the feedback that you have, and then we don't necessarily have a forum set up where folks come and talk to us about the impact of the legislation. However, we as a program continue to keep an eye on evaluation and monitoring for the impact of the legislation. And we do need to hear from folks like yourself in order to understand the impact that the program's having beyond just us following what the legislation requires of us so that we can consider that when we make future program decisions. So what I would do is encourage you to reach out to us first via email. I can commit to it not just being a form reply. I understand the frustration of feeling like we show up to government, folks just hear what we say and then continue to move forward. As a program manager, I strive not to exist in that space, which is why we're in this iterative reality of showing up every year back in front of the public, folks impacted by this legislation, to see what tweaks we can make so that it can support folks. Keeping in mind, though, that temporary staffing agencies are not the only folks impacted by this legislation. We also have to consider the workforce, which I really appreciate your call out, making sure that they're making livable wages and are able to support themselves, have freedom of employment and choices like that. And then we also have to consider the hospitals and facilities. So as we continue to embark on these conversations and talk to all impacted parties, we have to do this unique weave of making sure that we find a happy middle ground to land on. So I can commit to being responsive to what you are bringing forward and will respond in email or set up a call to have that conversation, but there's not a public forum to discuss the impacts of the legislation.
Awesome. Thank you, Joe. Yeah, I'll probably follow up even with some employee testimonies, and maybe I'd ask, the other people on this call to do the same. It's, we're talking about our businesses, but I think it's just as important, like you mentioned, to talk about what's actually happening to our employees and encourage people to write in with those employee testimonies too. But yeah, thank you.
Thank you, Keenan. Appreciate it.
Joe, there was a question in the chat. I don't know if you want to read that out loud or you want me to read it out. Do you see it?
Can you read it out? I'm not.
Sure. It's from Jennifer. I'm sorry, Jennifer, I mispronounced your last name, Slayton. I think it stated in the beginning of the presentation that the bill rate is exclusive of per diem. If our bill rate to the facility is an all-inclusive, would be back out the hourly equivalent of per diem to get the bill rate.
As a program, we avoid being prescriptive as to how folks should be building their bill rate. So I hesitate to give feedback on that situation in this meeting because I'm not sure that I'm 100% able to grasp how the math would need to work for each of you all. But yeah, the expectation would be that the value of the per diem stipend be carved out of that.
Joe, I'll just add to, I think that there's some confusion too, which I myself had in the beginning, which is when we use the term per diem, a lot of people have two definitions, and what we're referring to in today's rule changes are actually just per diem stipends. So like lodging, meals, incidentals, not that whole per diem bill rate for all work done is kind of what I think there's some overlap. So I just wanted to call that out.
All right, there are no more hands up and no more chats.
All right, if there's nothing additional that folks have, please do keep in mind that we'll send out the feedback form. So you'll have the opportunity to put your feelings and thoughts into that smart sheet, which will be collected and brought into this public comment period feedback that we have. I also encourage you to use the email if you have any additional questions or concerns for us so we can continue that bolster that FAQ. And much like was stated earlier, if you do all have any general feedback or testament that you would like to send us as a program so that we're aware of the impact of the legislation and the real world impact of it, we're happy to receive that and include it in our decision-making process. And I strongly encourage you to send that to us because, without it, we can't bring it into our consideration. So thank you so much for taking time out of your busy day and joining us today.
Can I add one last thing, Joe? Are you there? I just wanted to mention too, we do hold space for a workforce rack. So if TSAs would like to share that information with staff in the future, they can attend as well to give feedback.
All right. Thanks, everybody.